Well, the month of May is Mental Health Awareness Month, and U.S. Surgeon General Dr. Vivek Murthy has issued a new advisory on loneliness as a health issue. In the report, Dr. Murthy warns that loneliness poses a health risk just as deadly as smoking. He calls it an epidemic. He spoke about it today on GMA3.
This is a problem that has been building for decades in our country. COVID certainly worsened it. It poured fuel on the fire, but that fire was burning before. And as the world has moved faster and faster, as things have changed so much, as we now move around a lot, we change jobs a lot, how we communicate with one another has changed and often shifted from in-person to online. A lot of that together has actually taken a toll on our relationships. And now we're realizing that we've got to be intentional about rebuilding those relationships because they have a profound effect both on our mental health and our physical health.
That's the Surgeon General talking about loneliness. And to discuss this further, let's bring in clinical psychologist Dr. Jeff Gardere. Doctor, this advisory comes on the heels of a New York Times op-ed written by the Surgeon General, and it was titled, "We have become a lonely nation. It's time to fix that." You know, I'm just stumped. Why? You know, what's your take on this, and what's your biggest concern about it? I didn't think America was a fragmented, fractured, lonely country. People were, you know, in all kinds of groups. We were famous as a nation of joiners, and now it seems we're staying alone. What's going on?
So, Terry, as you alluded to earlier, and as Dr. Murthy had talked about, really the pandemic has lifted the curtain on many of our social ills. And one of those ills was the fact because of social media, because of the internet, we were certainly becoming a society that was very much insulated, focusing just on ourselves. Many of our activities were online, and we were starting to lose that human connection. Now we find that with the pandemic, since we were even more isolated, that loneliness has become an after effect of the COVID-19 pandemic. And now loneliness is an epidemic of its own. We're seeing a 50% increase in the risk of developing dementia for older adults, 29% increase in the risk of heart disease, 32% increase in the risk of stroke, premature death up by more than 60%, and certainly more depression. These are the things that are telling us, Terry, more than anything else, that as social animals, as human beings, that we need to be connected. Our evolution is about relying on one another, and we're losing that connection, and it's having deleterious effects.
Yeah, those are striking figures there. The advisory today also includes a framework, they call it, to combat loneliness. And that framework lists strengthening social infrastructure, enacting pro-connection public policies, mobilizing the health sector, reforming digital environments, deepening our knowledge, and cultivating a culture of connection. You know, that sounds great, but isn't it kind of up to each one of us to reach out to one another, kind of the old-fashioned way? Love thy neighbor?
Yeah, you're absolutely right. At the end of the day, the responsibility falls to us as individuals to make sure that we really operate as a social group. But some of those recommendations that you talked about really says, hey, we as a government, as institutions, as schools, as medical environments, that we need to participate in that. We need to make sure that parks, libraries stay open. As you know, in some states, there are some legislators that are trying to close down libraries. Make sure that we have playgrounds where our kids can connect with one another. Making sure that there's accessible public transportation and paid family leave so people can not only see one another, but when they need a break from having children, for example, or some sort of an illness, that they can recuperate but be there for one another. And most importantly, deepening our knowledge as to what's going on, not only in the medical and psychological field, but for us as a society. What is going on with this isolation, with loneliness, and what do each of us need to do to solve this problem? Because if we don't, the effects will continue to be dire.
Just saying hello to people on the street or reaching out to that brother you haven't spoken with in a while, I guess.
That's right. That's right. The basic, simple things.
And being aware, I guess, of our own loneliness. How do you counsel people to recognize loneliness in themselves and how it might differ from other conditions?
You know, it's one thing, Terry, to want to be by yourself and taking that time. It's another thing when it's forced upon you or you don't have a choice and you see that you're by yourself, you're becoming dysphoric, you feel that you're losing that human connection, and you see that, in fact, this dysphoria may be turning into a depression. That is a very, very clear sign that there is deprivation of humanity, deprivation of touch. So it's important that we recognize it and do something about it. But as you said, asking something like, hey, how are you doing? And really listening to what the person has to say and showing interest.
Well, I'm inspired to do a little bit more of that in my own life. Dr. Jeff Gardere, thanks very much for being with us.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.